So in neurons, like it's been estimated that in neurons that are active just during normal activity, up to 50% of the ATP is used to drive the sodium pump and the calcium pump to pump those ions back out after the neuron is fired. So when the neuron fires an action potential, when it's active, the sodium and calcium rush in, then you get a voltage change across the membrane, and then that's propagated, and it's important to rapidly remove the sodium and potassium so that the charge across the membrane gets back to where it was. And so, yeah, during normal aging, Alzheimer's, Parkinson's, if the mitochondria aren't working even a little bit less well than they are, there's this tendency for hyperexcitability. And so anyway, that's the destroyer part of the sculptor and destroyer.
How much of a role would the GABA production from being in ketosis help negate that?
Well, that's important. That's a good question. I think that from a drug standpoint, drugs that enhance GABA tone could be beneficial. The trick is it's a tricky business because glutamate is critical for learning and memory, and it's all our circuits essentially are glutamatergic, so you don't want them to go out of control, but you don't want the activity to go too low so that function isn't optimal.
What about testing that with something like a ketone ester to see, transiently?
No, we've done that. So Richard Veach in I can't remember what year again. Anyway, bottom line is he sent a postdoc up to my lab, and what was his name? Kashi, a Japanese postdoc, and together with people in my lab, in a mouse model of Alzheimer's disease, they gave the animals in the food ketone ester or not, and we had isocaloric, and then we looked at the amyloid accumulation, the neurofibrillary tangle, tau, and learning and memory, and the ketone ester was beneficial. And no, I think the ketone ester is very promising. A friend of mine up in Canada, Steve Cunan, has done some really nice work with PET imaging. So, all right. So one can get images of relative levels of utilization of glucose by brain cells or of ketones. So Steve Cunan he had radiolabeled glucose, 2-deoxyglucose, and radiolabeled, he used acetoacetate, but it doesn't matter. He didn't use beta hydroxybutyrate. Okay, so he had these were just initially normal people, but he's doing studies in people with mild cognitive impairment and Alzheimer's. So he had them, so when they're eating carbohydrates, brain cells use mainly glucose. When they go on a ketogenic diet, the brain cells switch. They clearly switch. It's very clear. They use a lot more ketones, maybe still using some glucose. And then in Alzheimer's disease, other investigators decades ago had shown that very early on, people with mild cognitive impairment, even somewhat during normal aging, there's reduced glucose utilization by brain cells. And however, we think, based on some of our animal studies and some preliminary studies in Alzheimer's patients of Steve's, that at least in people with early Alzheimer's disease, even though the brain cells have problems using glucose, they still seem to be using ketones very well. So this is something that is I'm excited about. And there's a neurologist that was under me at NIA that he's actually finishing up a study of intermittent fasting in people at risk for cognitive impairment. And he may be one of the places where these ketone ester studies are done. And then the why am I blanking on her name? Kieran Clark's work at Oxford with ketone ester and the elite British cyclists. Mm-hmm. So, yeah, that's a big deal in the endurance athletes, and the cost, right, for the average person, the cost of the ketone ester is way too much to make it practical, and we don't know for sure. It would be interesting to do like a comparison of someone fasting versus ketone ester. Then you could maybe sort out whether any endurance enhancing effect of intermittent fasting is in addition to ketone ester, or if it's all due to the ketones. But yeah, bottom line is I think that's a really promising.
As you mentioned, the cost is very prohibitive for most people, and I think of it. So I can tell you from just anecdotally, and I'm so sorry. I know you have to go. It's great speaking with you. So as a sort of a foot in the door to like maybe someone who is not motivated to try a ketogenic diet, perhaps they have cognitive decline or dementia, or maybe even early stage Alzheimer's. When they notice a beneficial effect from the ketone ester, and that's a lot more motivating for a person to have a real world piece of evidence where they feel an effect and say, okay, well, maybe I can try this diet that's not, that quite easy to do, but they may be more motivated
There's
to do it.
Also